It may look like just a fun arcade game, but this high-tech driving simulator is helping patients regain function and return to their everyday lives at home. Patients who have suffered a stroke, brain injury, or spinal cord injury may lose some function, including their abilities to drive safely.
Well, the value is that we have a ton of patients through different diseases and disabilities that all of a sudden their ability to drive really becomes a concern for physicians and the family members.
For many people, driving is important to maintain their independence, particularly as they get older. The simulator is a chance to test their abilities in a safe setting.
And so what we want to do as rehabilitation specialists is really the ultimate goal for all rehabilitation is to get people reintegrated back into community. And one of the core things about community reintegration, especially in a community like Twin, is the ability to drive and get from point A to point B and do it safely.
Not only can the simulator be used to test driving abilities, it can also train patients to compensate for any deficits.
So in the case of a patient who's become paralyzed from the waist down and can no longer operate the accelerator or the brake, these patients often require the use of hand controls. And those are very difficult to use, and they're really quite scary for patients to use in a real-world setting. So we can get them into the simulator. The simulator actually detaches. We can roll them up in their wheelchair and train them on how to use the hand accelerator and the hand brake so that they can actually transition into a real vehicle and have a safe transition.
The simulator allows the therapist to choose from a variety of vehicles to match the patient's real-world needs, from compact cars to large pickup trucks. I'm Kevin Ryan reporting for St. Luke's Health System.